So meaningful community engagement and involvement, or CEI, as we call it, is really a core mandate and key underpinning value across our global health research programs. And when CEI is meaningful, it will have real benefits in terms of the applicability of that research and its ability to meet the needs of individuals that it's targeting. And we really want to see communities harnessing their rights to be involved in the process, and for research teams to foster co-production where this is actually appropriate with communities, but bringing them all together with other stakeholders to solve these big health challenges. So we want to see those in the community who are most affected, being able to exercise their rights to be involved, to contribute towards decision making, and in really researching the potential solutions to the issues that actually affect the community.
Okay, so community engagement involvement is absolutely critical to the successful research projects, but I think is particularly so in terms of global research projects. It's really important because community members can guide their projects through their experiences in terms of getting the research question right, but also in defining the outputs and how we publicize the results of some of our studies. But clearly, there's conventional patient-public involvement in a number of research studies funded through the NIHR, but I think what is different about global research is across a number of domains. Firstly, as well as getting involved in defining the research question and helping with the design of the studies, it's important in terms of the outcome measures, because what's important to patients may not necessarily be our perception of what's important to them and their families.
I think as researchers, it's very easy for us to prioritise the needs of our research questions, and that sometimes makes us blind to the realities of the implications of the decisions that we make in pursuit of the research question. And actually, whenever we engage with the population that we're interested in helping through answering our research question, they always provide insights and understanding that we would never have thought about or understood.
The term patient and public involvement is the term that we use in the UK to refer to CEI. And I'd like to think that 100% of things correct for PPI are applicable to global health, but there are some aspects that are critical. So the main value that CEI does in global health research is to make the research project more relevant to communities.
Why else is it important? Because part of our global research is actually getting families directly involved in patient care, and that is unique to the global project, some of the work that we're undertaking in the lower middle income countries. And examples of that would include engaging families in acute observation of patients, their acute management to assist in their nursing care. And importantly, where rehabilitation is deficient in many parts of the world, we can actually undertake research and projects to get families engaged in the rehabilitation of their loved ones to try and give them the maximum chance of a good recovery.
So definitely community involvement in neurosurgical research is totally important, because at the end is how you interact with the final user of many of our interventions. And definitely is the possibility to have the perception of the people that is totally affected from many of these conditions in order to arrive in a better way with many of our science, and also the possibility to have the final user opinion into the whole process. So definitely, I think it's something that is a key aspect of many of the research that we perform in the field.
Community engagement program definitely would be very helpful to explain to the community what research means, what we are supposed to do, and how it's going to help the community in the future.
Community involvement in research can be valuable in several ways. First, involving community in research can help us ensure that the research is relevant to the community first, and then involving community members in research would better be they'll better be able to provide insights into the most important and most pressing health issues that are directly affecting them.
Well, I started off actually not by being involved in research, but by talking about research. So I wrote a talk about my own brain injury. And to do that, I needed to understand what had happened to me. So I spoke to some researchers and found out a bit more about it. And through that process, I was invited to join the Rescue ASDH study about craniotomy and craniectomy and craniotomy. So I became an involved patient. Before that, I didn't even know what an involved patient was. At the moment, I'm working for the Brain Injury MedTech Cooperative. They're an organisation that brings together investors and researchers and clinicians and patients and carers to talk to each other to improve interventions in brain injury. So I think that's really valuable because it means that we can get a wider voice of people, and we're trying to attract a diverse group of patients and carers who have had different experiences and come from different backgrounds, so that we can really inform the way that research is developed and delivered.
So you as a group are in an area that's actually really known to have significant challenges in terms of involving communities. So the UNICEF minimum standards for community engagement, as well as the NIH co-production guidelines, are really important and useful when thinking about how to meaningfully work with communities. So these guides focus on principles such as that active involvement and sharing power as we're carrying out research, and also ensuring that the community and the researchers are empowered by the process, and that there is local ownership. You focus on those aspects of inclusion and ensuring that you're bringing in people that have been marginalized, and also focusing on building capacity, again, within research and the community and people learning together, and ensuring that there's bi-directional communication throughout the whole process.
There's challenges at a number of levels. I think we're still learning about the best way for patient and public engagement in the UK research, but globally it is more challenging because often we're not directly there. And I think we have to design ways and look at ways in which we can engage them as stakeholders.
So definitely translating many of the science where we, with the ones that we handle every day in the methodological aspects of the development of research is really a challenging aspect, but definitely is nothing that is not impossible. And we can tackle that organizing the science behind, and also having the knowledge to understand the context and the interactions within this community.
So you have to think of creative ways of engaging with communities so that you are able to bridge the gap because of these low levels of literacy.
I believe one of the greatest challenges in community involvement and engagement would be to ensure that community members feel invested in the research process and its outcomes, of course. And community members may be like, they may be doubtful and or skeptical of the research studies, particularly specifically if they have previous unpleasant or experience of injustices, or if they think or perceive that their voices will not be heard. I think to overcome this challenge, it would be important to engage them in a meaningful and respectful dialogue with community members and involve them as partners in our research rather than just participants in the research process.
One of the challenges that we had with the Global Surgery Unit is making relevant our findings from our trials onto patients. Case in point, our two big trials looked at interventions that relied on actions from the surgical team, which might seem very disconnected from the plight or the experience of patients. However, upon speaking to community members, what we found out was that their needs were self-managing surgical site infections. So it's looking at research outside of the hospital. How are patients able to self-manage their condition, especially if they live very far from the hospital? And so one of our big CEI projects this year would be to create a community surgical site infection prevention toolkit with the community members.
For example, that there's reluctancy and cultural beliefs and difficulty for certain communities or for the community to really get involved in research. And that is not easy for the researchers to collect data and to bring out their findings. So I think that is a very interesting project that we really need to look into it and see the measures we can put in place to encourage the community to get more involved in research, since it is for them that this research is being done in reality, because whatever findings we get, proportions or suggestions are being made, recommendations are being made, all that to better the situation.
Actually, we can't just put one model of CEI across the whole programme and ask everybody to implement it in the same way. Actually, we need to be really flexible, and we need to look at what is right for each of the different communities, the different studies in the programme.
For me, I found that being involved has been enormously rewarding, partly because I'm a bit of a nerd and I'm really interested in the way the research works and I'm kind of fascinated by the process, but also because I'm constantly reminded that people are actually interested in my experience and using what I think about stuff to inform the way that they work. And that's quite valuable. You feel kind of validated, you know, when people thank you for taking part and bringing up something that they hadn't thought about, that's great, right? That's a success. And we all like success, but particularly in recovery from brain injury, I think being able to achieve stuff and feel valued is really important, encouraging your own recovery, both physically as well as psychologically.
I have an important experience involving communities in neurosurgical research, especially focused in the process of development and testing guidelines in neurotrauma. So when we developed our first set of guidelines for the National Ministry of Health in Colombia, we involved many communities organizing the questions that we try to move within the process of developing recommendations for managing these patients. And was a really fascinating experience trying to involve patients and relatives and in general communities that are the most affected and vulnerable to this type of conditions.
First, we have to identify the community, like what aspect of them we want to engage, and then we will of course the willing members, we will have to recruit those members who are willing and who we believe who can be of interest and of value to us, and of course if the research project is of interest to them as well. And then we're going to establish some goals and guidelines for the groups to follow, and when to meet, how to meet, and who is going to moderate. And then we'll, of course, we will have to provide some training and resources to them as well.
I think it's very important as a new global health group to establish your reputation within the community. This is very important because it's quite obvious you need the buy-in of the community, but also there's documented literature that saying that communities in the global south are actually able to recognize a research group over a trial. And what I mean by that is, if a group is working closely with a community for years, and this is a relationship built in time or with time, it sometimes the trial and the study is immaterial as long as they know that they're working with a particular group. Think of it as a continuing relationship that goes beyond the trial, beyond the study, even beyond a funding application.
We would like to challenge the group to continue with their CEI work involving carers as a proxy and a key stakeholder group, but crucially also finding innovative ways to involve people who have experienced and are living with acquired brain and spinal injuries. And ultimately, we would like to work with you to ensure that the group achieves maximum impact in strengthening care, treatment, quality of life,